Hello, my name is Alicia Sinclair. For my preceptorship, I was able to work with Pravina Sharma, who is the Senior Director of Nursing Acute Care at Martin Luther King Jr. Community Hospital. For my leadership project, we focused on increasing nurse recruitment and retention at MLK Hospital. Through my research, I was able to discover how significant of a problem nursing recruitment and retention is. The World Health Organization estimates that issues with nurse recruitment and retention are on the verge of becoming a universal problem, which further complicates the situation, given the growing need for community nurses. Also, there is a growing number of registered nurses that are planning to retire or leave their jobs within the next 2 years. Additionally, there has been a decline in enrollment and graduations from RN programs. With all of this information, these developments have resulted in a decrease in availability of RNs when compared to previously projected figures. This is a major issue because of several factors. As the population ages, medical technology progresses, and the prevalence of chronic illnesses rise, so does the need for healthcare services. The lack of nurses may result in poor patient care and a reduction in ability of the healthcare system to deliver timely and efficient services at a community hospital such as Martin Luther King Jr. Community Hospital. During my research, I determined that Cotter's 8-step change model was the most applicable change theory for my project. I tailored Cotter's 8 steps to my research project as it allows the opportunity to explore both the strategic planning and practical implementation aspects of the change process. The first step is create a sense of urgency. I achieve this by providing statistics, trends, and additional data that highlight the issue of nursing recruitment and retention. The second step is building a guiding coalition. This involves identifying key stakeholders, which include nursing hospital administrators, nursing leaders, HR professionals, and staff nurses who will be a part of the change process. The third step is forming a strategic vision and initiative. This includes our desired outcomes and benefits that the hospital aims to achieve with implementing our plan for nursing recruitment and retention. The fourth step involved a voluntary army, which can include staff, nurses, and other employees. The fifth step is enable action by removing barriers. Therefore, we will identify potential barriers and potential solutions to these barriers. The sixth step is generating short-term wins by highlighting early successes. We can demonstrate positive outcomes related to our nursing recruitment and retention plan. The seventh step is sustaining acceleration, which will involve plans for the hospital to continue supporting the nursing recruitment and retention initiatives even after the initial successes. And the final step is instituting change, which involves a description of how the hospital intends to institutionalize the changes related to nursing recruitment and retention. My PCOT question was, in a community hospital setting, such as Martin Luther King Jr. Community Hospital, how does implementing a comprehensive nurse recruitment and retention program compared to the standard recruitment and retention practices affect nurse recruitment, nurse turnover rates, and job satisfaction over a period of 12 months? In contrast to the hospital's current protocols and procedures, this PCOT question will focus on assessing the efficacy of a particular intervention, which will be our new comprehensive nursing recruiting and retention program. And with these findings, we could provide management at the hospital with information about the efficacy of the comprehensive program in addressing the difficulties of nurse recruitment and retention at MLK Community Hospital. For my review of the literature and summary of evidence, the databases used included PubMed, CINAHL, ProQuest, Google Scholar, and JAMA. Some of the key terms identified in the literature search included nurse retention, satisfaction, professional well-being, turnover, nursing shortage, recruitment, and strategies. In research articles and evidence collected, researchers use a variety of research designs, including systemic reviews, meta-analysis, integrative literature reviews, and semi-structured interviews. Researchers utilize a range of samples, including nurses and physicians from the U.S. magnet hospitals, nurses practicing in California, surveys, abstracts, and peer reviewed articles. Through the literature, I was able to identify recommended best practices. So the first one was competitive pay and benefits, which are vital to attracting and retaining nurses, as these factors are associated with higher work satisfaction and a decrease in turnover. Another best practice was a supportive work environment that promotes teamwork, professional development, and a work life balance. Research also recommended nurse residency programs, mentorship programs, and opportunities for continued education, which will provide crucial support for both new and experienced nurses. It is also recommended that nurses have an effective workload management, employee assistance programs, and diversity and inclusion initiatives to help lower stress levels, promote well being, and create a healthy work environment. Overall, healthcare organizations must adopt a multifaceted strategy that incorporates these evidence based practices to create a satisfied and committed nursing workforce, which will ultimately improve patient care quality. My preceptor and I were able to compose a comprehensive plan and policy for our plan of action. The goal of this plan is to strengthen nurse recruitment and retention efforts within MLK Community Hospital by establishing a nurturing work environment that fosters job satisfaction, encourages professional growth, and promotes work life balance. To achieve this objective, several key components are proposed, which I will discuss over the next couple of slides. One of the first components of our comprehensive plan and policy is building the pipeline, which focuses on nurse recruitment. Building the pipeline focuses on targeting education by offering volunteer nurse programs in partnership with high schools in the surrounding area, including King Drew, Compton Early College, Centennial, and Manuel Dominguez. MLK Hospital will also create partnerships with colleges in the surrounding areas, offering nursing scholarships and attending college career fairs. The next step in our comprehensive plan and policy for increasing nursing recruitment is leveraging technology. The hospital will focus on marketing and advertising campaigns that highlight financial benefits and other incentives, and will also advertise monthly walk in interviews. In addition, they will utilize traditional and digital channels to reach potential candidates. For example, appealing to the younger generation of nurses on Instagram and TikTok. We will also ask the current nurses at MLK to promote MLK's social media profiles, videos, and posts. In our focus of retaining nurses at MLK, we have created 5 focal points. The first one is compensation. Regular market analysis will be conducted to ensure competitive nurse salaries and a comprehensive benefits package, which will include health insurance, retirement plans, and paid time off. We will also focus on growth availability and offer continuing education programs, mentorship opportunities, and a career development pathway to help nurses expand their knowledge and skills. There will also be leadership development programs and other incentives such as retention bonuses and a good attendance reward. The second focal point will be a supportive work environment. The hospital will promote a culture of respect, collaboration, and diversity and inclusion. This will be achieved by creating a nurse led committee to address workplace concerns and advocate for nursing staff. We will also focus on effective communication, which involves organizational communication, communication with local leadership, and communication of policy changes. The third focal point will be adequate staffing. The nurse patient ratios will be monitored and adjusted to ensure manageable workloads. There will be adequate staffing of CNAs, sitters, RNs, and charge nurses. There will also be an implementation of technology and workflow optimization to reduce administrative burdens. The fourth focal point will be a formal recognition program to acknowledge nurse achievements and contributions complemented by peer recognition and patient feedback. The final focal point is enhancing the new grad residency program at MOK by ensuring a structured orientation, having experienced nurses as clinical preceptors, a monthly skills day for new grads, and an effective and efficient transition to practice program. We identified potential barriers to our comprehensive plan and policy for nursing recruitment and retention. The first potential barrier is resistance to change. Existing staff members and leadership may resist changes to established practices. A proposed solution would be to foster a culture of openness and inclusiveness by key stakeholders in policy development, communicate the rationale behind the changes, and emphasizing how they align with the hospital's mission and will be a benefit to both nurses and patients. The second potential barrier would be limited resources. Allocating resources for a comprehensive policy can be challenging. A proposed solution would be to prioritize resource allocation by demonstrating the potential return on investment. We can also explore grants, partnerships, or cost sharing options to secure necessary resources. The third potential barrier is the complex implementation process. Rolling out a new policy across various departments and shifts can be complex and overwhelming for staff. The proposed solution would be to develop a phased implementation plan that outlines clear steps, timelines, and responsibilities, while also providing ample training and support to ensure all staff members understand the policy and their roles in its success. Our implementation plan is based on research data and recommended best practices. This comprehensive nurse recruitment and retention policy will be implemented through collaboration with hospital management, which will include the CNO and COO, nursing leadership and managers, and frontline staff. This implementation plan involves forming a multidisciplinary team to oversee the policy, communicating the policy to all staff and providing adequate training, and integrating the policy into existing hospital processes. The duration of the study is chosen at 12 months to give enough time to observe any appreciable changes brought on by the execution of the intervention. Our evaluation of the comprehensive nursing recruitment and retention plan will be conducted at different intervals of the implementation. We suggest an evaluation every 3 months during the 12-month duration of the plan. The evaluation plans include collecting data on nurse turnover rates, conducting periodic assessments, benchmarking against industry standards, establishing feedback mechanisms, defining key performance indicators, analyzing data and preparing reports, continuously improving the policy based on findings, and tracking its impact over the long term. The responsibility for data collection will be shared among different stakeholders within the hospital, including nursing leadership and human resources personnel. Human resources personnel will be responsible for gathering turnover data, recruitment metrics, and other quantitative indicators. Nursing leadership will be responsible for overseeing the collection of qualitative data, which can include feedback from nurses through surveys, focus groups, and/or suggestion boxes. In conclusion, by adhering to this comprehensive policy and plan, Martin Luther King Jr. Community Hospital can continuously enhance its nurse recruitment and retention efforts, creating a workplace environment that attracts, supports, and retains a skilled and committed nursing workforce. I would also like to thank my preceptor, Pravina Sharma, and everyone at MOK for providing me an amazing experience during my preceptorship. Also, these are my references used throughout my project and for the recommended best practices. Thank you.